have been asked to give this lecture on the right to health. And when closing these sessions, we come to talk about the right to health. And here you have the less indicated person, the person who least would meet the expectations of the listeners who are already tired because it's running late after these tiring sessions that, although all of them are very interesting, I think that they've meant a significant effort. So I think that I am the most inappropriate person to give this presentation. But it's important to say that, well, we have the right to health. And I think that it is useful to meditate around these issues. Some people wouldn't believe me. And in this case, we know that you might find it useful to cut it short in order to have a deserved rest. Well, I have some paragraphs to share with you. The paragraphs that I'll be reading literally state the following. To the rule of law, we have opposed the de facto rule. The nation continues to live without respecting legislation, without guarantees, without independent courts, without independent tribunals, and the Spanish person lives under the arbitrary decisions of corrupted people. In Europe, something has disappeared, and in Spain, the arbitrary decisions continue to happen, and they act as if it was the decision of masons. First, we have admirable pieces of law that do not work, and there's also anarchy, where freedom and justice are the privilege of the bad people, where the righteous people would succumb if he doesn't become corrupt. Many of us agree with this definition of Spain, and any of us might have spelled it out, but it isn't the case. This statement belongs to a conservative politician who lived in 1898, Francisco de Silvela, and he even became president of the government. So we find here a whole century of stagnation has gone by. And myself, as a lawyer, I've been repeating these statements from this politician. I've been telling people that there's the absence of independent justice system. So there's the null value of the pieces of legislation. And I remember a speaker at the Speaker's Corner at Hyde Park. He was asked why he repeated constantly the same statements when nobody paid attention to him. And then he said that at the beginning, he would do this at the beginning in order to convince people. But in recent times, he repeated things constantly for people not to convince him, because he wanted to defend himself from people convincing him. And yes, certainly there are many people who say this cannot be, that there are pieces of legislation that exist and should be abided by. Well, yes, in theory, we have pieces of legislation, but in practice, the reality is very different. And a few examples will show this. Article 10.14, the General Health Act pronounces that we all have the right to obtain the medicine and the health products required to reestablish our health, and how many sufferers of MCS are with us who require medicine and do not get it. And even there are people who do have the medicine but will not give the medicine to the sufferers of MCS because they don't want to, even if the legislation states this right. And in Madrid, according to the General Health Act, we read that the medical visit might be suspended unless there is a risk, a obvious risk to health. This in Madrid, in Article 142C, when there is the reasonable suspicion of imminent risk to the health of the individual, obviously the activity at that premise should be suspended. But anybody of you, could he say that the treatment had been suspended in Fundación Alborada when, even when the premises, the hazardous premises, didn't stop activities. So we went to the court and we said, well, in the meantime, while we wait for the court decision, please suspend the hazardous premises activities because many people are, are being damaged by those premises that continue to work, to operate. And according to Article 130.2, we read that this wouldn't be given when it would damage the rights of third parties. And how could we damage our patients with our nutrients cocktail? And the reason given by the community of Madrid to suspend the activities of Fundación Alborada is that there are two specific products. One is intralipid, and the other one, the thiotiacid, that weren't amongst those products that are authorized by the authority. But the remaining products, given that they are not into the text, logically, they might be used. But no, it's not that case, because the regional administration of Madrid extended the banning to all the other products as well. So we are talking about arbitrary decisions. We are not talking about the legal compliance, and this is even much more serious because certain individuals asked the Spanish Agency of Medicine and Health Devices to get the right authorization in order to get the benefits from the therapies provided by the center of Pellerin, and these other products were authorized, excepting intralipid, but the other products, yes, they could be given out. Therefore, the banning on the usage is maintained in an arbitrary decision. It is true. So we might analyze other cases. We might say that the code of deontology in the United States states to respect human life, dignity of the human being are the preliminary duties of the physician. And would there be anybody here doubting that Dr. Pilar thought first about the patients instead of looking after herself and her own health? You might say that she was complying with the code of deontology, and she was chased and she was taken to courts because of looking after the needs of her patients. This is um, outrageous, and we see that respecting the legality, because of respecting the legality, we may be sanctioned, and when infringing um, the rules, the legal rules, well, you know what happens in Spain. Just read in the newspapers. So this is the price that Dr. Pilar Calero has to pay for looking after her patients. And there's another important article, 20.1. The physician must be free to prescribe and to get the right conditions to look after the patient. And in the paragraph 1 of the statement of Nuremberg for those physicians working in the European community, all of them will get the guarantee that the physicians will be free to make decisions and to choose the right treatment and therapies. Would anybody of you would say that Pilar Calero is free to decide what is the best therapy to give to her patients? We see that it is not the case. She's not free in making decisions. So this legislation is not complied with. And the maximum advocate of deontology, Dr. Pilar Calero, is considered the transgressor, is considered to be the offender. This is something that is happening in a country where legislation is not enforced, is not complied with, and the pieces of legislation in our country are not abided by. And in theory, there is the right to health, but in practice, this principle is not respected. And I would stop here because I'm aware that truth doesn't want to be listened to. I don't know whether you know that man who, when walking down the street, he saw a sign outside a shop, and he walked in and he asked the clerk, "Is it true that you sell truth? And what type of truth would you like?" "I want the true truth." Because the clerk would say, "What type of truth would you like? Half truth, full truth, semi truth? If you want absolute truth, you'll have to pay a very high price, you know." And the man insisted, "No matter what, I want this full freedom. I want full truth. I'm tired of lies. What's the price I have to pay?" And the price to be paid is that when you get to know the full truth, you will not have days for rest. You will never get rest in your life. And then he walked out because he decided that he still wanted to live thanks to the lies. But let's be honest. Let's be frank to ourselves. And many of us aren't ready for full truth, for the true truth. Because I don't know whether you know that the best people around us, the brilliant people, those who are the smartest and cleverest, those that are the more idealistic, those with the most ethical minds disappeared from Spain because of going out to conquer America, because of being confined into the different monasteries that were at that time, or because of being killed by the Inquisition. So the uh, the bravest and the most brilliant Spanish people disappeared from Spain. They had been called to be the yeast of the future generations, and this is why that healthy rebelliousness has become a disappointing decision, a disappointing way of being. The farmer went out to the field, and the hen produced eggs, and the hen would be feeding on the worms and would be looking after the chicks. And one day there was a beautiful bird overflying the farm, and then this hen asked the other hen, uh, that bird, what is it? Well, that's the imperial eagle, but we are different. Don't pay attention to that magnificent bird. And the hen died because she didn't like to be a mere hen. So we must understand our defects, and we must admit that we are resigned because we think that we cannot do anything in order to fight a government that allows for fraud and undue enrichment of companies that are making money out of the health of the individuals, making money out of hormones that are injected into farm animals, that we are guinea pigs in order to be experimented with after consuming food coming from transgenic food, plants and animals.
Pero mejor no.
We can go on and on, but it's better not to, because identifying these abuses and protesting against these abuses means being isolated, being ostracized, being called a rebel, conflictive, because it is not politically correct. But it's necessary to speak loud and clear, as Mark Twain said. Let's get angry enough to be able to do something, at least. Or should we continue to remain quiet? We do not even have this law in Spain to access to information. We can ask about each of the product that's being used. We are the only European country that still does not have this law on transparency, the accountability law. Do you know when that was passed in Sweden? In 1766. But we still do not have that in Spain, in our country. Here, it's necessary to continue to be in the dark, lack of control, illegal economy, and rampant corruption. The laws are in a drawer in the parliament. They are not passed. These laws are not passed because it's not interesting to change things. I'm taking time away from your leisure, but I have a moral commitment to try to present a solution, because I think it's not fair not to have rights, and it is even worse to be resigned and to give in once again. The more we give in, the more space we abandon, the worse the situation will be in regard to our rights. And something must be done so that our destiny will not be in the hands of those that have already destroyed our health, our destiny of the past 36 or 35 years, the so-called democracy. In China, of thousands of years ago, students of Confucius openly opposed administration and judges
Y en
when they
nuestra
were
España,
considered to be
en los
arbitrary.
siglos XVI
In
y
Spain,
XVII,
in the 16th
había
and 17th
personajes
century,
ilustres,
there were
conocidos por
illustrious
sus
people who
reconfortados
did the
masterpieces
same.
de arquitectura. Francisco de Vitoria,
Francisco de Vitoria,
Domingo de Soto,
Domingo de Soto,
Vázquez de Menchaca,
Vázquez de Menchaca,
Juan Luis Vives,
Juan Luis
Francisco
Vives,
Suárez,
Francisco Suárez,
Rodrigo de Arriaga,
Rodrigo de Arriaga,
Francisco de Quevedo,
Francisco de Quevedo,
Juan Ginés Sepúlveda,
Juan Ginés
Saavedra
Sepúlveda,
Pájaro
Saavedra Pájaro,
y tantos otros
and
humanistas
so many, many more who demonstrated that in our country there was a period of time when one openly opposed this situation. Juan de Mariana said that that was not done sufficiently. There wasn't even sufficient opposition. Now, what about Rome? The Romans really understood law, their rights, and how to apply their laws. And the Romans met at the Monte Sacro, at the Holy Mount, to get rid of the corrupt, to get rid of those that did not respect the law. Just like in the case of Claudius. In Rome, the rights, the law, were out in the street. The Romans knew their rights and knew their law and how to demand that the law be applied correctly. We have laws, acts, health acts that embody our rights, but it's necessary to look for additional solutions because this is not sufficient. Before we had an article in 407 in criminal process, in criminal proceedings, that it was an interesting article in the criminal proceedings 407, Article 407, that sanctioned the judges who did not apply the criminal proceedings appropriately. The judges said that that type of sanction was not constitutional, and the Constitutional Court said that it was constitutional, but despite that, that article was removed from the criminal proceedings. And basically, we have the Supreme Court, we have also other different mechanisms that ensure that the laws will be applied, but this is just to give you an example of how the judges were able to get rid of Article 407 from the criminal proceedings. The right to health is presented as the biggest, the most important commitment of a state, of a democracy. It is regulated in Article 43.1, which focuses on improving health, which is directly linked to dignity. If dignity is not achieved, then you do not have full practice of your rights. And there's also justification of any decision based on the interest of the whole, social interest of the public. That's the focus now. But we should get the policy makers to be aware of the desires of their communities. And they should pay attention to what their communities demand and to take all the necessary measures and take the necessary endeavors to provide health and benefits to the community at large. I think that one has to be coherent. And I would like to encourage you
el arma más poderosa
to remember
que
that
podríamos
we
usar,
have the most powerful
y es la Constitución.
weapon or tool,
Nuestra
our
Constitución
Constitution.
tiene 30
Our
y tantos años.
Constitution is 33 or 34 years old. It's still young. I would say that very few
Se produce una
are familiar
situación
with the Constitution.
infavorable que nos lleva a acercarnos al
We
sentido de la
have a
Constitución americana,
situation where I think
cambiando lo
we
que aquí
might
fue
be able
pues, un
to
instrumento político.
achieve
O sea, las
what the
constituciones de
American Constitution
1812,
has
de
achieved. The
1845,
constitutions of
del
1812,
76, eran
1976,
simplemente
and
instrumentos
others were
políticos que
just
regulaban las
political
reglas claras
instruments that
sin que tuviesen
regulated the
ningún contenido
monarchy,
práctico y
the
sencillamente fuesen
houses of
consideradas
parliament.
normas. Pero no, nuestra actual
Our
Constitución,
current constitution,
al menos que la
however,
Constitución republicana que
just like the
existe en
Republican
México,
Constitution in
por la
1931,
guerra
but
civil.
it was short-lived
Pero ahora
because of the
nuestra
Civil War.
Constitución
But our
es,
Constitution now, as I was saying,
no pensaba que era la Guardia Civil.
no, I thought it was the Guardia Civil who were warning me. Don't worry. Well,
De los grises y
yes,
monstruos.
to tell you,
De hecho,
I must say
que esta
that when I was younger, I had Franco's police after me. And we have, as I was saying, our law of laws, our constitution today, and this is what should be applied in courts. But curiously, not understanding the Constitution and not applying the Constitution, if that's done by our jurists, our legal authorities, really leads us to terrible situations, just like these treaties by Muñoz Calero. Luis Martinez Calcerada, who's well known in the legal community. He was a professor of civil rights, participated also in drawing up the Constitution, and he was also a magistrate. He was also a member of the Supreme Court. He was also a member of the Supreme Court. According to the Constitution, Chapter 3, you have the Chapter 2, Chapter 1. According to this chapter, this can only be presented under the ordinary legal authorities. What is presented here? This means that the Constitution can be applied directly. The Constitution regulates health according to Article 43, and based on what the Constitution states, we shall be creating laws. And so that's not new. That's not being applied. I have here a court ruling of the Constitutional Court. Court ruling 66, 28 April, corrects the ruling of the Supreme Court. The Constitutional Court corrects the ruling of the Supreme Court. It states in its sentence that the constitutional precepts cannot be presented before the courts because that is stated in the Constitution, and the Constitutional Court says that that is not solidly based. There is nowhere in the Constitution where that is stated. The Constitutional Court continues stating that Constitution is not just a catalog of principles, that until it becomes developed through this legal system as stated here, it is the juridical norm, it is the highest, the law of the highest order that should be followed by our legal system. For this reason, its precepts should and can be presented before the
Tribunal
court.
Constitucional
The
corrige
tribunal,
los
the
legisladores cuando
Constitutional
colocaron el derecho a
Court
la salud, y esto
corrects
aparenta
the
ser más
Supreme
importante de
Court
todo, en
when
un capítulo que
it
no
makes a
tenía
ruling
acceso a una cuestión
on
de
a
constitucionalidad o a un artículo
point
que
that
llamaba
has to do with
estricto.
health and the right to
En
health.
la Constitución, el capítulo
In our
segundo está
Constitution,
dedicado a unos
Chapter
derechos
2 has
fundamentales
to
que
do
podríamos
with
llamar
fundamental
fundamentalizados
rights.
porque eso nos
Very
permite a
fundamental
nosotros
rights because it
no solo
allows
recabar
us
la tutela
not
genérica de
only
jueces y
to
tribunales,
ask
sino en forma
for
privada
the
de ella
protection of
a pedir al
courts and
Tribunal
judges, but
Constitucional.
also to
Sin embargo, en el capítulo
claim before
tercero
the Constitutional Court.
solo se
However,
recogen
Chapter
principios
3
rectores,
only
una diferencia
describes
enorme.
the proceedings. That's a big
Evidentemente muy
difference.
importante,
It is a
porque
big
si el
difference
derecho a la salud lo
because
tenemos dentro de los
if
artículos
our
del
right
14
to
al 29
health
y el
is
32 de
embodied
la
in
Constitución,
Articles 14 to
obviamente podemos no
20
solo llegar al
and
constitucional, sino
30.2,
aplicando esta a los tribunales
evidently, it is
internacionales,
necessary
porque a Estrasburgo,
to
porque de
turn to the
Ginebra,
Institutional
porque
Court.
de las
If that cannot be
instituciones
done, then we can
europeas,
turn to
los
the international
parlamentos,
courts,
consejos de
the
Europa y todo lo demás.
courts of
Pero
Europe.
la suerte, repito, es que el
But
Constitucional,
fortunately,
muchísimo antes de que se
the
publicasen
Constitutional
estos
Court,
libros, ya
before
dijo en
these
una sentencia, y esto
texts
sí
were
que es
published,
importante,
these
que es lo que
books
no,
were
no
published,
hubiese querido cansar en
I didn't
exceso
want to
con algunas
bore you
consideraciones circunstantes.
with
Pero esta
so many
sentencia
slides
es muy
on laws
importante,
stating only these
que es la
principles.
sentencia del Tribunal
It is important to
Constitucional
take into
del ciclo
account
de
that 35,
1996,
Court Ruling
del 11
35
de marzo,
of
reiterado a la
1996, 11th
reciente, la
March,
sentencia
which is repeated in
160-2007 del 9 de noviembre.
106,
Deja
160
tremendamente
bar
claro, y lo
2007
cito
of
textualmente,
7th of
que el
July,
derecho a que no
states
se
that
dañe
the
o perjudique
right
la salud personal
to
queda también
avoid
comprendido en el derecho a
injury
la
to
integridad
personal
personal
health
protegido por el
also
artículo 15.
leads to the right
Están colocados
to
dentro
personal
de los derechos
integrity
susceptibles de amparo.
within
Artículo
as
15,
embodied in
derecho
Article
a la vida.
15, the right to
Dentro de
life,
este
and
apartado, el derecho a
within
la integridad
this
personal,
article,
está
the right
incluido
to
el derecho
personal
a que no se dañe
integrity
o perjudique nuestra salud.
includes right to
Y
not
hay otra
to be
sentencia
injured,
tremendamente importante
right
también del Tribunal
to
Constitucional que dice
have
que no es necesario
protection for
esperar
our health. So these are
a que la
protective
lesión a la
measures.
integridad personal se haya
So it's
consumado,
necessary
lo que
not to
convertiría la
wait
tutela constitucional en
until
una protección
until
ineficaz ex
injury has
post. O sea,
been
si nosotros vamos
caused
a pedir al tribunal que se está dañando nuestra salud,
for the
y
protective
se supone que
measures to
esperar
be
hasta dar con el
applied.
circuito todo el
You cannot
recorrido
do
legal,
that ex
pues nos vamos a
post.
encontrar que cuando lleguemos al
We will see
constitucional
that
o no existimos o
if
estamos en
that is
buena
the
condición para
approach, then we
defendernos.
will be in a poor state
Entonces
of
hay dos
health
vías.
when
Ya
we
tenemos muy claro que esto
eventually
parte un poco de esperanza,
receive
porque de
the
entrada
protective
nosotros
measures
conocemos que
of
existe
the
una
courts.
posibilidad
So
pues,
that's very
realmente no
important
existe,
because
pero no
that
estamos
links
fallando, pero
and
sí
takes into
vamos un poquito
account also protection
ya
to
estamos
prevent
situados
these
en el artículo
injuries.
15
We
del
are in
Constitución.
Article 15 of
El
the
artículo 15
Constitution.
nos
Article
advierte que existe
15
nuestro derecho constitucional a la
states
protección de la
our
salud. Y
rights to
esto nos va a
health,
permitir abrir dos vías
protection
para
of our
llegar a
health.
nuestra
So we
seguridad
have
personal.
two
Una
paths,
es
two
acudir a la
important
Constitución
paths.
pidiendo en base a este
One,
artículo 15 que se nos respete
based on
nuestro
Article
derecho a la salud, que se
15 on our
preserve el
right to
Estado
health,
las
we
farmacéuticas
can demand from
vamos perdiendo.
administration to
Y
protect
si las
our health.
administraciones no
And
funcionan,
if administration
nos
does
dicen que
not
no, que
function
no nos
or
contestan, nos vamos a los
does not even
tribunales. Y en
answer
los
us or
tribunales
rejects that, then
planteamos
go to
esta
the
situación por
courts
la vía del
and
artículo
present
114 y
this
siguientes, que es la vía de protección de
referring
los
to
derechos
Article
fundamentales que se utiliza
114, which has to
definitivamente
do with
poquísimo.
the fundamental rights and fundamental
Esto no está
protection,
ocurriendo para
which
descargar la
is used
protección
very
a
little.
efectos de la
At one time, I had a traffic fine, and I said that you're violating my rights, and he said, no, this was in 2009, and he said that there's no such law in that regard. So that's a very terrible situation because we have this special way, channel. It's an exceptional situation. You you file your demand that will be taken by the secretary to the court, and the court will decide immediately because our rights, fundamental rights, are at risk. And we shall be claiming our constitutional rights to health, knowing they will know that if we're not attended to here in Spain through our legal systems, we can present this claim to the European courts. We can present also individual demands based on Article 29 to Parliament, individually or as a group. That is also covered by 14, 29, and 32. These articles. This allows us to file or claim to the Constitutional Court. And we can list the reasons why we demand our protection to the Parliament also, either as individuals or as a group. If that is not attended to immediately, then there's a conflict of authority. Then we will have between the courts and the Parliament, then we will have to turn to the Constitutional Court. They have 3 months to make a ruling. And then if that is not attended to, then we can go to the court in Strasbourg and the human rights courts, etc. There are ways, but it's necessary to know them, to be familiar with them, and to use them. But that will not function, even though they exist, if we do that in an isolated fashion. It will not function if we do not have the support necessary for all just and fair demands. This meeting with the presence of Dr. William Ria, Dr. Jean Monroe, Martin Paul, Peter Onsorge, Pilar Muñoz Calero, and others will get us to question the data that we have obtained, gives us solid ground to question the measures that are being taken by administration. In the end, just like in the story of an elephant that was destroying all the orchards, and the people of the village complained to the Maharaja, and they all went and said that, well, this is what's being done by your elephant, and it's necessary for you to take action. And it is necessary to claim as a group, as the villagers did. They all went to the Maharaja to force the Maharaja to take action. So once again, I must emphasize that we should all work in conjunction. I think 4 people will not be enough. I think it is necessary for all of us to work together. The Maharaja, to continue the story, said that, what are you doing here? Why are you bothering me? And the representative said, I came here to tell you that your elephant feels lonely and your elephant needs another elephant for company. Oh, and the Maharaja began to listen. What I mean to say is that when we look for our representative or lawyers, I strongly recommend that you get lawyers that oppose power, that oppose the injustice, those that are clearly opposed to this abuse of authority. If you do not have that characteristic, a lawyer with that characteristic, it's very difficult to succeed. You can get a lawyer which is offered by the courts, appointed by the legal system, the ex officio, appointed by the courts. That lawyer is obliged to work on behalf of the client. There is another law of the 10th of January that states that you can demand from the courts an appointment of a lawyer ex officio. If there are certain circumstances that that produces costs or due to certain diseases, etc., etc., don't get a lawyer that will not defend your interests correctly. Get one, as I said, with the characteristics I mentioned before. Get a court-appointed lawyer and a lawyer ex officio, because they are obliged to protect their clients. And you can claim against that lawyer if the defense is not done properly. As Rudolf von Jhering said, the law and rights is a continuous struggle, and we should struggle for our rights to health. We should not allow injustice to prevail. That is our obligation as citizens. That is the obligation of the victims. And that is also each individual's obligation for moral self-preservation. It is also an obligation for our community, because the right has to prevail. The rights have to prevail over those who had worked and published these rights. Administration, courts, if our demands are rejected, that is not the end of the story. That is just the beginning. Success starts with being firmly resolved to win. We should not be resigned. Our claims, our demands, the objectives of our lives has to do with our defense and recovery of our rights, preservation of our rights, and we should do everything we possibly can to achieve that. Thank you.